Welcome back to Trends and Friends. Well, if you're having some neck pain or even possibly some neck and back pain or possibly even headaches, Dr. Andrew Azab from All Family Chiropractic is here to help. So Dr. Azab, it's always a pleasure to have you here.
Yes, thank you for having me back.
Thank you for coming. So let's talk about this, because if we are having some kind of reoccurring pains, what are some of the things that we can do? What do you look for when someone comes into your office with those kinds of pains?
We basically see if it is due to a joint problem. We check their neck, their back, their lower back, and see if we can, oftentimes we're able to reproduce the pain with various tests that we do to basically define the source of the pain, and then we appropriately treat it.
Okay. So once you kind of know where that pain's coming from, how would you go about treating it? I mean, I know it's more than just a spinal, area that you guys work in. It's kind of a full area or full scope of things.
Right. We treat the joint problem by getting, oftentimes the joints don't move the way that they should, or sometimes they move too much, and then we treat that affects the nerve problem, and we treat the nerve problem directly as well as the muscle issue, oftentimes with massage or trigger point therapy. A lot of people think that chiropractic care is just for the spine.
Yeah.
Well, it isn't. It's also for extremity problems like shoulder. When I mean extremities, I mean shoulders, elbows, knees, hips, feet, wrists. We treat all those joint problems. And we have orthopedic tests, neurologic tests, and we oftentimes x-ray to see what's going on with those joints. And those joints can be stiff and immobile, and when they're stiff and immobile, you can't move them and you can't use them appropriately. The muscles around them can get tight or go into spasm, or you can develop tendinitis in them. Rotator cuff tendinitis, rotator cuff problems are one of the very most common things that I treat after neck pain, back pain, and headaches. Shoulder problems are the third most, or come right after that. Hip joint problems we also treat. A lot of people don't realize that when you take a single step forward, your hip joint has to move, but so does your sacroiliac joint in your lower back has to move. And hip joint problems are implicated in lower back problems commonly. A lot of people who play sports, although you don't have to play sports to get tennis elbow, you can get tennis elbow from other things. It's a repetitive use problem, and we treat that commonly as well as golfer's elbow. It just depends on which tendon is affected, and we treat the tendon and the muscle and the joint, because oftentimes the joint is not moving the way that it should, and the muscle around it has to move too much, has to use too much energy to try to get that joint to move, and you get tendinitis and pain within there, resulting in tennis elbow, golfer's elbow.
Okay, so what are some of the treatments that you would do? I know you said a little bit about massage and some of those things. Can you tell us a little bit more about what treatment options would be available, just depending on their level of pain?
We check the joint to see how it's moving, and we treat that. If the joint's not moving appropriately, we treat that with manipulation. Manipulation is just a gentle force put into the joint to get it loosened up and to move appropriately. And then there are multiple types of massage that we do. Transverse friction massage, oftentimes for tendons, to help break up scar tissue within the tendon. Trigger point therapy to help decrease the spasm within the belly of the muscle, which is the thicker part of the muscle there.
A lot of techniques.
And we also, a lot of techniques, and we also have electrotherapy, ice packs, hot packs that we can apply to those areas to help get rid of the spasm and the inflammation and the tendinitis, both within joint and the muscle.
A lot of information there. Thank you so much for sharing that. And for those at home, if you are having that kind of pain and experiencing some of that, Dr. Azab is definitely there to help you. There on your screen, he's located at 4505 82nd Street, Suite 9. Thank you so much, Dr. Azab.
Thank you so much.
Appreciate you being here.
Thank you.
And up next, Christy Martinez Garcia has your Latino Lubbock update. That's after the break.